Welcome to another edition of Senior Talks, an exciting new educational program for those age 45 and up in the Harris County area. Senior Talks presents presentations on opioid use, medication management, recovery, and overall health. Senior Talks are sponsored by the Harris County Area Agency on Aging and the Council on Recovery's Wellderly program. Today we have Rossana Ishee, Older Adult Specialist for the Wellderly program, and Leah Bell, Older Adult Recovery Coach for the Wellderly program, here to present to you an introduction, an overview of the opioid crisis. Leah and Rossana, take it away.
Hi, Rossana. How are you?
Hi, Leah. It's good to see you again.
Good to see you too.
Thank you
it's
for
great.
joining us.
Yes, it's good to see you here, and thank you for joining us. In the late 1990s, pharmaceutical companies reassured the medical community that opioid painkillers were safe for patients to consume. And so in turn, the physicians, they wrote prescriptions at greater rates. Well, the increased prescription of opioid medication led to a widespread increased prescriptions of opioid medications led to a widespread of misuse of both prescription and non-prescription opioids. And all of this was done way before it was clear that these medications could indeed be highly addictive.
That's right, Leah. That's right, Leah. And along with that, other factors such as the opioids, like you were saying, being prescribed inappropriately and misunderstanding the adverse effects of long-term pain management therapy. And opioid misuse, abuse, and dependence have all contributed to the opioid crisis.
Yes, for instance, 100 plus people have died every day in 2017. Also, nearly 30,000 deaths were due to opioids in a 12-month period ending in 2017. And over 800,000 individuals began to use heroin. Now, 75% of these heroin users, of these 800,000, 75%, their initial experience with opioids was by a prescription painkiller.
Yeah, that's really interesting information.
Yes.
And just going back a little bit too, in 2015 alone, there were 52,000 people who died of drug overdoses, and with over 30,000 individuals of those dying from opioid drugs.
Okay.
And patients taking prescription opioids at higher doses and for longer periods of time puts them at risk. And of course, it's life-threatening, obviously, from what the data shows.
Yes, of course.
So these numbers are actually most likely higher since people of all age groups don't usually admit to having an opioid use disorder. And that's understandable because due to the possible loss of job, judgment, or a lack of understanding by friends, family, even their doctors, which is also known as stigma.
Yeah. And also the earliest age of opioid use addiction is 12 years old. Isn't that terrible?
Yes. That's really
that's
a staggering number.
That is frightening, yes.
So we're also seeing an increase in heroin use, the spread of HIV and hepatitis C, which is resulting from prescription opioid addiction and misuse. Currently, there are more than 1 million people who need treatment but don't have access. So along with the crisis of chronic pain, we have this crisis of opioid misuse and overdose.
Yes. So in 2017, the Health and Human Services declared a public health emergency and announced a set of strategies to combat the opioid crisis and to empower local communities in the front in the front lines.
Mhm.
And some of these strategies were, one was prevention, and inside of prevention was treatment and also recovery. And so in the prevention, what they did was put together prevention strategies to go into the community to educate the community,
Mhm.
the community of opioid use disorder, and also to educate the public at hand of what addiction looked like, to try to eliminate some of the stigma that came along with opioid use disorder
Mhm.
or substance use disorder altogether. And also with recovery, what they did is they put together a plan where um, the forefront runners would be recovery coaches. Recovery coaches, they would be the ones boots on the ground.
Mhm.
And so what they would do is help individuals who suffered from opioid use disorder, substance use disorder. Also, they put together treatment where they made treatment available for everyone. And more accessible to families. And they also put together treatment for families because, of course, it affects everyone. It doesn't just affect the person using, it affects the whole entire family and eventually the community.
That's right.
Mhm.
And speaking of which, other public health, social, and economic factors, the cost of health care, lost productivity, substance abuse treatment, and criminal justice involvement. That's all affects the community.
Mhm.
And also opioid overdoses in large cities showed an increase by 54% in 16 of our states. And again, families, jobs, self-esteem, mental health, financial, and legal issues are all severely impacted.
Yes. And also with some of these strategies, what they did was put together a peer workforce.
Mhm.
So what they did, they went in and they educated and trained law enforcement agencies and officers to enable them to identify when someone was at risk of opioid use or opioid user,
Mhm.
and to find preventions for them, treatments other than arrest.
Sounds great.
Yes.
That could even eliminate some of the, lower the incarceration rate that's
Yes.
related to the substance misuse.
And I'm glad you said that because they also work with the criminal justice
Yeah.
system to implement a plan to help individuals that
great.
suffer from opioid use disorder,
Mhm.
because it's not a choice, it is an addiction. It is a disease in the brain that affects the reward system, you know. And
That's
so individuals who are addicted, they are addicted due to substance, due to a brain illness.
Mhm. And addition to some of the strategies that you had mentioned, Leah, access to treatment and recovery services for all individuals, not just those that can afford it, but to all individuals across the board. That's what we
Exactly.
need.
Exactly.
And education on and use of overdose reversing drugs such as naloxone, and which will also be presenting information specific to overdose prevention at a later date.
Mm-hmm. Yeah. And also for the treatment piece of these strategies, support was given for pregnant women and postpartum women who suffer with opioid use disorder. So yeah, they're put together quite a bit of plans to help with individuals that are suffering from this crisis.
And we still have a ways to go, but there's some strategies and things in place right now, heading us into the right direction.
Yes. The Health and Human Service Agency is also very focused right now on how they can find the most effective efforts to combat this issue. Yes. So we all can take a part in the fight against opioid addiction, or should I say, we all can take a part in the fight against opioid misuse and abuse, by becoming aware of the issue at hand and learning how to identify addiction and to reach out for help and learn how to navigate through the treatment options for your loved ones or yourself.
Definitely. So if you or someone you know, excuse me, if you or someone you know needs help or further information, please reach out to us at the
Yes.
Council on Recovery or call us, either one of us at the Wellderly program. The information will be shown on the screen. And so this concludes our presentation. Please stay tuned for our next segment of Senior Talks.
And
Thank
thank
you.
you.
Thank you, Leah.
Thank you, Rossana.